Today, we're going to unpack the science behind a new drug that could seriously be a massive leap forward in how we treat obesity and diabetes. It's called Orforglipron, and the big deal? It's a daily pill that might just have the power to match today's top weight loss injections. Okay, let's dive right in.
I mean, just think about that question for a second. This is the holy grail that researchers are chasing. We already have these incredibly effective injectable drugs, right? But for so many people, the needle itself is just a major hurdle. So the ultimate goal is to pack all of that power into a simple, easy-to-take pill. And it looks like Orforglipron might be the breakthrough we've been waiting for.
All right, so to really understand why this new pill is such a game changer, we kind of have to look at where we are right now. We're in the middle of a genuine revolution in weight loss medicine, but, it's not without its own set of challenges.
Yeah, there is absolutely no doubt that injectable GLP-1 agonists, drugs like Semaglutide, have completely transformed everything. But let's be real. For a lifelong condition like obesity, the idea of daily or weekly injections forever, that's a tough pill to swallow, pardon the pun. Needle anxiety is a very real thing, and it stops a lot of people from even starting these treatments or from sticking with them long term.
Now you might be thinking, hey, don't we already have an oral GLP-1 pill? And you're right, we do. But it comes with a whole rule book. You have to take it on a totally empty stomach, then you have to wait to eat or drink anything else. Why? Because the drug molecule is so fragile, it needs this special enhancer to help it survive the gut. And even with all that, the bioavailability, that's the amount that actually makes it into your bloodstream, is less than 1%. So the new goal is a pill without all those hoops to jump through. And that's where the science gets really, really cool.
So, how did they finally crack the code on this? Well, the answer was to completely redesign the drug from the ground up, starting with its most basic structure. This is really clever stuff.
Okay, this slide really nails the core concept. It's basically a story of big versus small. On the left, you've got the older drugs like semaglutide. They're peptides, these big, long, kind of delicate protein chains. They're designed to mimic our hormones, but your stomach acid just shreds them. The analogy here is perfect. It's like trying to unlock a door with a key made of soft protein. It just falls apart. But on the right, you have Orforglipron. It's a non-peptide small molecule. So think of it less like a protein key and more like a sturdy, perfectly cut metal key. It's designed in a lab to be tough, stable, and totally unfazed by your stomach.
And here it is. This is the actual molecule. You can just see it, right? It looks nothing like a big floppy protein. It's compact, it's rigid, it's a synthetic structure. This amazing bit of chemical engineering is what lets it survive the journey through the stomach and get absorbed easily, all without needing any of those special conditions or fasting. So this new structure doesn't just make the pill more durable. It actually lets Orforglipron work in a totally different and frankly, much smarter way once it gets to its target.
To really get this, we need to know this one term, allosteric binding. So imagine a receptor is like a high-tech lock on a door. Most drugs are like a key that fits right into the main keyhole. That's the front door. But an allosteric drug is different. It's like a secret key that finds a hidden side door on the lock. And when it binds there, it subtly changes the lock's shape and turns it on that way.
And that's exactly how the traditional peptide drugs work. They're huge molecules, so they have to bind to the outside of the GLP-1 receptor, right at that main front door. It works, for sure, but it's the standard head-on approach.
But here, this is the twist. This is the magic. Orforglipron, because it's so small and precisely shaped, it doesn't even bother with the front door. It literally slips past the outside of the receptor and finds a hidden pocket deep inside its core. It's activating the whole system from within. That is the side door mechanism in action, and it is a brilliant workaround.
So what's the point of all this? Well, binding to this side door doesn't just flip a simple on switch. It leads to something called G-protein biased signaling. Think of it as being more like a dimmer switch than an on-off switch. It seems to selectively activate the good pathways, the ones that improve your metabolism, while maybe not activating other pathways that you don't want. This is truly smart drug design. It could mean more targeted, more efficient effects in the long run.
Okay, that is the fascinating science. But what does it actually mean for real people? Let's check out the clinical trial data and see how all this cool chemistry translates into real-world benefits.
Right off the bat, the first win is just pure convenience. All those strict rules, gone. You can take Orforglipron whenever, with or without food. And just look at that jump in bioavailability. we go from less than 1% to somewhere around 30 to 40%. That is a gigantic leap in reliability. It means your body is actually getting a predictable, effective dose of the medicine every single time. And now, let's talk numbers. This table pulls together data from the major trials, and wow, the results are powerful. We're seeing huge, clinically meaningful drops not just in body weight, but across the board. Blood sugar, down. Systolic blood pressure, down. Triglycerides, down. The big picture here couldn't be clearer. This isn't just a weight loss drug. It's a total cardiometabolic health drug.
You know, what's truly mind-blowing is how consistent these effects are. For things like blood pressure and lipids, a statistical value called I-squared, which measures how much the results varied between studies, was 0. 0. That almost never happens. It suggests this is a super predictable, reliable effect, which researchers think links right back to that unique, smart signaling mechanism we were just talking about.
Of course, there's always a trade-off. No drug is perfect. The main side effects here are gastrointestinal, which is pretty much expected for this entire class of medications. We're talking about things like nausea, diarrhea, that sort of thing. The good news is these are typically dose-dependent, and the studies show that if you start low and go slow with the dosage, it really helps manage them.
So when you put together this powerful data and this truly novel science, you have to ask, where does a drug like orforglipron fit into the future of medicine?
I mean, this quote from the researchers who analyzed all the clinical data, it really says it all. A paradigm shift. That's not a term scientists throw around lightly. It highlights just how profoundly this new type of drug could change our whole approach to treatment.
So when you boil it all down, the path forward becomes pretty clear. First, you've proven you can get injectable-level results in a simple pill. That's huge. Second, you've made it way more convenient. No needles, no fasting, which is critical for long-term success. And third, because it's a small molecule, it might be cheaper to make, which could potentially open up access for so many more people.
And that really leaves us with this final, big-picture question. The science is moving at an incredible pace, delivering these medicines that are smarter and more convenient than we ever thought possible. But as we're standing on the edge of these amazing breakthroughs, you have to wonder, is inventing them still the biggest challenge? Or is our next great challenge figuring out how to make sure these incredible tools can actually get to every single person who needs them?